Welcome to the ParaGard IUC Insertion Training and Patient Counseling DVD.
As you might imagine, there have been many new developments in contraception over the years. Today, women have more options than before.
And their expectations for contraception are higher than ever.
Hello, I'm Dr. Anita Nelson. I've been practicing obstetrics and gynecology at the Harbor UCLA Medical Center for more than 2 decades. Many of my patients ask for contraception that is convenient, reliable, safe, and readily reversible. So what does this mean to clinicians? It means that we can now offer ParaGard to a wider range of patients who might potentially benefit from it. Younger, nulliparous patients who aren't ready to start a family yet, or maybe some patients who have decided not to have children and need highly effective birth control. As I go through the steps of the procedure, keep in mind that everything is done gently for the patient's comfort. And you've had one before?
Yes.
Yeah? How did it go for you?
That was great.
Yeah? And why did you stop using it?
Because I wanted to have another baby.
And did you have any problems at all having
Not
a baby?
at all.
Not at all? Okay. So you know already about the risks and the benefits, and we've reviewed the consent form. Do you have any questions now at all about what's going on? Now let's quickly review some of the key points of proper insertion technique. Always use aseptic technique. To properly load ParaGard, the arms must be folded down not more than 5 minutes before insertion. Loading ParaGard just after uterine sounding and just prior to insertion will help ensure the arms stay folded down in the proper position. After releasing the arms, move the insertion tube upward until slight resistance of the fundus is felt. This helps to assure high fundal placement. Then remove the solid rod first before removing the insertion tube. Record the length of the threads as well as the lot number of the device on the patient's chart. As you can see, the insertion technique for ParaGard is very straightforward. We take out the speculum. How are you feeling?
Fine.
Yeah? Keep in mind that insertion of instruments into the cervical os may result in vasovagal reactions. Feeling any dizziness? Including fainting. Any cramping? Are you doing okay? You did beautifully. You really did. That was great.
Patient counseling is important both before and after insertion of ParaGard. Once you and your patient have decided that ParaGard is the right option, you should counsel her on what to expect before, during, and after insertion. Are you feeling okay?
So far, so good.
Any pain or dizziness?
A little bit of cramping. Nothing else. I feel pretty good, actually.
Sounds like you may be ready to go home. But before you go, there are a few more things that we need to talk about.
Okay. Oh, but I forgot to ask you before, how soon before my ParaGard starts working?
Right away.